borders. Reinforcing our commitment to provide world-class healthcare, Apollo Hospitals has always been at the forefront of medical innovation, compassionate care, and advanced healthcare services. And our journey here today is a testament of these values. In the ever-evolving landscape of healthcare, Apollo Hospitals Bangalore has consistently pushed the boundaries to transform lives through excellence in clinical outcomes, advanced technology, and patient-centric approach. Our team of highly skilled and dedicated professionals worked tirelessly to ensure that every patient receives the best possible care tailored to their individual needs. As we extend our presence to Maldives, our goal is to bring our expertise and advanced medical care closer to you. We understand the unique healthcare needs of this region and are committed to collaborating with local healthcare providers to enhance the overall health and well-being of the Maldivian community. Our initiatives will focus on providing access to the specialized medical treatments, advanced diagnostics, and comprehensive care programs, ensuring that quality healthcare is accessible to all. Apollo Hospitals Bangalore is equipped with state-of-the-art facilities and cutting-edge technology, world-class consultants, enabling us to deliver high standards of care across various medical specialties. Medical advancements, offering our patients the latest in medical services and treatment. Healthcare is not just about treating illness. It is about building healthy communities. We are dedicated to fostering partnerships with local healthcare institutions, government bodies, and community organizations to create robust healthcare ecosystem. Together, we can address pressing health challenges, promote preventive care to enhance overall quality of life for the people of Maldives. As we embark on this new journey, we are filled with optimism and determination. The future of healthcare lies in collaboration, innovation, and relentless pursuit of excellence. Apollo Hospitals Bangalore is committed to being a trusted healthcare partner for the Maldives, and we look forward to making a positive and lasting impact on the health and well-being of the Maldivians. I would like you to have a look at what we do at Apollo Hospitals through this video testimony.
Apollo Hospitals Bangalore is one of the most trusted hospitals offering high quality and comprehensive medical care. At Apollo Hospitals, healthcare goes beyond our four walls, and it starts the moment you enter. We provide world-class healthcare to our patients. Our state-of-the-art technology, supported by internationally trained experts around the world, is the testament to it, treating with minimal invasive approach and robotic-assisted procedures. Our Center of Excellence each institutes synonyms with personal care and attention to details that makes Apollo Hospital South India's most trusted hospital. We have a dedicated international patient desk and lounge. Our team provides in-house interpreters, travel desks, and prioritize doctors' appointments. Inspired by 5 strong pillars in its pursuit of excellence, we are here to bring you a warm and seamless healing experience at Apollo. It is a picture of reassurance. Welcome to Apollo Hospitals.
Thank you so much. Now let us, meet our panel of experts, like Dr. Satish Satyanarayan, our Senior Consultant Neurosurgeon, Dr. Girish Navasundi, Senior Consultant and Director, Cath Lab Interventional Cardiology, Dr. Rani Bhatt, Senior Consultant, Gynec Oncology and Robotic Surgeon, Dr. Sridhar P.S., Senior Consultant, Radiation Oncology and Cyberknife Expert, and Professor Satish Nair, Senior Consultant, ENT, Head and Neck Surgeon and Robotic Surgeon. So I would like to start with Dr. Satyanarayan on the views on the neurosciences.
Thank you very much, Abu, and a warm welcome to all the press which has come here today for this meeting. And we bring greetings from Bangalore, Apollo Hospitals, where we are all working as colleagues. This hospital is about 18 years old now, and it is one of the foremost ones in Bangalore, having the cutting edge technology, expertise and experience of consultants. Coming to neurosurgery, as you're all aware, this specialty deals with brain and spine, and mainly the surgical conditions which affect the brain as well as the spine. Now, if we run through the conditions which actually we come across, one of the most common ones are very common from both an Indian perspective and Maldivian perspective. Brain tumors are one of the more common ones that we deal with on a day-to-day basis. Now, there was a time, maybe about 20-25 years back, where the very mention of the word brain tumor, would bring a lot of pessimism to the patient and would think that, this is like a death sentence kind of a situation. But things have changed over the period of 20-25 years, and technologies have improved to an extent that we could treat majority of these patients in a very compassionate and very precise and with good outcomes. So brain tumors is one of the major categories that we at Apollo Hospital treat. And for this, we have advancements like, advanced robotic microscopes, endoscopes, where we can do through minimally invasive natural orifice areas. For example, base of the skull tumors often were considered as almost inoperable or very difficult to reach. Nowadays, one is with technology platforms such as the neuroendoscopy, and with collaboration with teams like we collaborate with Dr. Satish Nair, who is a head and neck surgeon. Some of these very difficult to access areas are now routinely approached, and with very good outcomes with very minimal complications. Now, this is possible when you have a good platform of technology as well as people with a good experience having years of exposure to dealing with these kind of tumors. Also, we need to have a very comprehensive center where these patients are not just operated and then sent elsewhere for additional adjuvant therapy. Luckily, in our hospital, we do have the facility for continuation of the care based on the requirement. For example, our oncology specialists help us out with some of the very advanced platforms, and with Dr. Sridhar will talk about one of the major advances in radiotherapy. So we have imminently going to be having the Cyberknife, which is under installation, as well as TrueBeam is another platform, with both of which are very important in treating tumors which are residual after surgery or which, because of their pathology, need additional treatment. Along with this, we also specialize in cerebrovascular field, where conditions like aneurysms, we often see patients who have had subarachnoid hemorrhage from Maldives as well, and this is a very urgently to be treated condition, but in some instances they're even able to reach to the hospitals if they've recovered from the first bleed. So these are treated either by surgical clipping in advanced varieties, otherwise they could also be treated by neuroendovascular means, by coiling or stenting. This is one of the areas where we have a lot of expertise and experience. Along with that, we are one of the level 1 trauma centers, so we manage a lot of polytrauma, head injury, patients who are very critical because of multiple organs involved, etc. They're usually transferred here because of the availability of 24/7 senior consultants of all specialties which are involved in trauma care. We also have a good amount of exposure, and we deal with pediatric neurosurgical patients. So pediatrics is again a separate entity, because these are not just little adults, but we have to treat them as separately because they have unique problems and need unique solutions. Other major category that we deal with are spine, And spine, because of our lifestyle and because of the nature of the problem, we have a very high incidence nowadays of degenerative spinal conditions. People who have cervical spondylitis, who go on to develop compression of the spinal cord and the nerves, then lumbar spondylitis, that is the lower back pain, lumbago, and we call it also a sciatica, where there is nerve compression, root compression to the nerves supplying the legs. Now, these are very, very common conditions across the globe. We see that. And although majority of these patients can do very well with, therapies which are conservative, a certain percentage of them will reach a stage where they need intervention surgically. Here we have the expertise of doing it in minimal access fashion, because that again requires intraoperative imaging. So there is a very advanced platform called O-arm. Now, this is like a CT scan inside the OT. Very, very few hospitals have it, mainly because of the cost and operative issues, etc. So we are lucky that we are having this platform and we have been using it successfully intraoperatively. This gives us the opportunity to open the patient's spine in very small incisions and precisely place implants and other surgical maneuvers in that small openings. And we can confirm the placement of all these implants and the success of the surgery intraoperatively itself, unlike before, where we would have to review the x-rays post-operatively, and sometimes, if need be, they would require revision. Here, because of this technology platform, we're able to identify and correct, if required, at the time of surgery itself. Therefore, the patient is more in safer zone, as well as they're able to get mobilized the very next day after such major surgeries, and usually within 2 or 3 days, they are discharged. We also have a neurorehabilitation program. We do have collaborations with other centers nearby. Therefore, there is continuation of care in these patients with spinal injuries and spinal trauma, as well as degenerative spinal conditions. So what we could conclude is, for neurosciences, it is not just an area of excellence, the Apollo Hospital Bangalore which provides, but we do have the expertise and the technology solutions for advanced care for these patients. I think that will sum it up in a short summary. Thank you.
Hello and welcome. And I'm Dr. Girish Navasundi. I'm an interventional cardiologist. I'm very delighted to be here among with you all in Maldives. As humans, as doctors, it's our moral responsibility to bring in the best of human skill and technology for all the people across the borders, as Mr. Abubakar just conveyed. It's been the vision of our chairman to impact every life so positively that most can live to best of their potential. Towards that, the way the people of Maldives share their natural beauty and hospitality with the rest of the world, we from India, especially Bangalore, we are pioneers in terms of technology and human skill. We have always invested tremendously into building global standard of healthcare in terms of skills and the cutting edge technology, which brings healthcare of a global standard at a very affordable or efficient pricing. Today, globally, the greatest challenge is for every human an access to the global best standard of healthcare. I think India, especially Bangalore, has been able to bring best of human skill and technology for all the people across the globe. And we receive patients from more than 70 countries at this point in time. Coming specifically to heart, we all know heart is center of human existence, both emotionally and physically. As long as heart works, a person is alive. So it becomes a responsibility for all of us to nurture this small organ which works relentlessly from the time we are in mother's womb to our last breath. And we also need to be mindful of the fact that this organ can be affected by birth or most often by our lifestyle. Being of South Asian origin, genetically we are more vulnerable for cardiovascular disease, means disease of the heart and the blood pipe. When I look at Maldivians, like some of South Indians are more vulnerable for heart attack, heart failure, cardiac arrest, and stroke. This happens because of the risk factors that exist and the lifestyle. I've seen in this community, I think people live a bit of stressed life, and quite a large proportion of them smoke. And their diet also, although it is sea-based food, but also a lot of oil. So when we look at how do we prevent disease among the Maldivian community, and when there is a need for cutting-edge medical science to heal them and bring them back to their families with much better productivity and longer life, it's important to collaborate. We are very glad the government of Maldives has tremendously invested into the well-being of people, offering them across the globe access to the best of healthcare, either directly or through insurance companies, and that's a great initiative. We from Bangalore have been meeting, treating patients from Maldives for quite a few decades, and many of them have been even educated in Bangalore. Coming to heart, you must understand that there are three diseases which are different but very dangerous. One is heart attack, the second one is heart failure, third one is cardiac arrest. Heart attack happens when the blood pipes that supply oxygen to the heart get clogged by cholesterol or calcium. Blood flow stoppage leads to damage, that's called heart attack. Heart failure is a situation where heart cannot pump adequate amount of blood to meet the demands of the body. They become weaker and weaker, and they have repeated hospitalization for either breathing difficulty or exhaustion. Third condition is called cardiac arrest, where the electrical activity suddenly becomes impaired or stops, leading to stoppage of oxygen supply to the brain and other body. These are to a large extent preventable. You have a great healthcare system in some parts of Maldives, which is able to manage a large portion of cardiovascular disease. Very efficient people, able to diagnose and identify. But I think there is a portion of disease that needs to be managed by a much technically advanced and more skilled healthcare professionals. I think when you seek that highest level of healthcare skills and the best of the technologies, I think we are one of the most sought after healthcare destination, that is Apollo Hospitals, Bangalore. We are very glad to partner, and I'm sure there are many patients in this region who would vouch for their experience. When it comes to heart blockages, we are one of the pioneers in doing the most complex, means when there are 100% blockages in multiple vessels who cannot be treated by a bypass, we do angioplasty on them. Or those who have undergone a bypass and they redevelop blockages, which again needs high level of competence to treat, we do angioplasty on them. There's another category where the blood vessel is blocked with substance which is so hard, called calcium, that it becomes very difficult to open them. We expertise in them by doing rotablation, that means drilling through that calcium, and what we call lithotripsy, where we insert a balloon which has got a sonic ultrasound waves which can break up the block and open the vessels. And also we do most of our cases under vision. That means we do not do depending on the angiogram, but introduce a camera inside the blood vessel, understand what is blocking, what is the length of the vessel, how long is the block, and when we implant a stent, how well it is done to conclude. Why? Whenever you do a medical therapy, we have one chance and we have to do the best. So we are pioneers in that front. Secondly, coming to the bypasses, we're the pioneers in the world. We do minimally invasive cardiac surgery and robotic heart surgeries. We are the only center in the country at this point, and we are the largest minimally invasive bypass center in the world, not in the region. So that's the level of competence that we have. And coming to the valve diseases, again we are pioneers, where most people do by opening the chest. We never open. It is done through about 2.5 inches incision under what we call minimally invasive cardiac surgery or robotic cardiac surgery. And those people who are not fit for a surgery because of aging or other problems like problem in the lungs, kidney, or other issues, we implant a new valve of the heart without any cut or stitch by going through the groin like an angiogram. It's called transcatheter valve implantation. We are again a pioneer. We are one of the most sought after in the world for doing transcatheter valve replacements for aortic valve, mitral valve, even for tricuspid valve. And coming to prevention of sudden cardiac death, we had a young girl from Mali very recently. She had 3 episodes of unconsciousness, 21 years old. She was supposed to do, skydive. When she was detected by experts here, she had a very irregular heartbeat, which was almost making her die suddenly. And she was implanted with a device called a defibrillator, which prevents sudden cardiac death. And we are one of the pioneers in that. And she can go back and do her skydiving again. And we'll show you that video next time when we are here. And coming to heart failure and transplants and artificial heart implants, again, we are in the forefront. Any disease of the heart or the blood vessels, you don't even have to flinch or think twice. You can reach out to us at Apollo Hospitals, Bangalore. We have one of the best solutions, which is of the global best standards. And welcome for your experience. Thank you.
Thank you, sir. Thank you so much. Over to you, Dr. Rani.
Good morning, everyone. And it's been a pleasure to be here. My name is Dr. Rani Bhatt, and I'm a gynae-oncologist and a robotic surgeon. When we look at incidence of cancer across the globe, it's on rise, including in Maldives. Now, when we especially talk about women's cancer, breast cancer is one of the leading cancer in women. Then we are coming to the cervix, colorectal, ovary. Then we have thyroid and the other cancers. So my specialty, if you see, of the 5 which I just named, we have cervix and we have ovary. Now, cervix is an easily preventable cancer. And I was happy to learn that in 2019, the Maldivian government started the HPV vaccination, because 70% of cervical cancers are caused by HPV virus. Virus doesn't even, it's just not cervix, it causes vaginal, vulval, the head and neck, and the rectal cancer. HPV virus can also cause cancer in men, that is of the penis, the head and neck, and the anal. So HPV vaccine is one of the only vaccine we have in the world that can prevent cancer. So I'm happy to learn that, there's already a program in Maldives to give HPV vaccine to the young adults. Across the world, we say, prevention is the best medicine. So prevention can be done through vaccination and education. Education is by knowing, understanding what causes the disease and how we can prevent it. So if you really look at the statistics, 1/3 of the cancers can be decreased with prevention. Prevention, as I said, by taking HPV vaccine, having a healthy lifestyle, obviously stopping tobacco or smoking. The other 1/3 of it can be controlled by early detection and treating. So early detection, every lady who has been sexually active should have her pap smear done. And we recommend once in 3 years to do a pap smear and a HPV testing until we are 65. Why do we do this is, again, as I said, cervical cancer doesn't turn into cancer overnight. There is a gap of 10 years time where there are some changes and then it turns to cancer. So if we pick up this, we can treat the cancer very easily and cancer becomes curable. Like you heard my colleagues saying, any disease, the first treatment should be the best treatment for us to have a very good outcome. So similarly, cervical cancer is the cancer which you can easily prevent by HPV vaccination and by doing a regular pap smear test. Again, as I said, until we are 65, just not once in a lifetime, just do it and forget it. You do it until you're 65. The second cancer, the breast, ovary, and endometrial cancer, is on the rise because of lifestyle changes and increase in obesity. Of late, we are seeing young girls. I've had a couple of them less than 30 years with uterine cancer. Unfortunately, God has given only one uterus. So when there's a uterine cancer, there is no other way that you can treat medically. You have to do a surgical treatment for them. Again, why we at Apollo, we are very different is that we do have all facilities under one roof. Now, this young girl, if I have to treat with a uterine cancer, she has plans of having a family. So I need to address that. So we need an infertility specialist. So we need a big team, what we generally say as a multi-tumor board team, where we discuss them and see what is the best options we have for this young lady. Similarly, a young lady after pregnancy developed a simple condition called molar pregnancy, which is very, very common cancer which can happen after pregnancy. Was advised that she has to undergo chemotherapy, following which her uterus had to be removed because she was not responding. Came to Apollo, we restudied, we had a meeting, and we said she still has hope. We gave a chemotherapy, and 1 year later she conceived normally and had a healthy baby boy. So cancer treatment is, you need a big team, and that's what we are very strong here at Apollo. So we not only have a cancer specialist, but we have an infertility, we have OBG department, so that we take care of the lady right from beginning till the end. My second interest is endometriosis. Now again, like cancer, endometriosis is a very chronic condition. So endometriosis is a chronic debilitating condition and which happens in a young woman. So this is so painful. Like if you ask those patients who have endometriosis, they will tell you that during the periods, they are just not in a position to kind of do any activity. So there is a way that you can treat endometriosis, but identifying endometriosis is the cause of a pain is the most important. So you shouldn't neglect any pain during menstruation, just saying it could be just a menstrual pain. Again, endometriosis can be treated medically and can be treated surgically. Now we here at Apollo Hospital, we are one of the centers who do highest number of robotic surgery in gynecology. Now, why does robotic help us in condition like endometriosis is that the robotic arm exactly mimics that of my hand movements. So, I can do a very, very fine surgery in a young girl who has endometriosis where there is scarring, the tubes are really stuck. So I can do a very fine surgery and release the tube so that later on she can go and have a chance of conceiving normally. So robotic surgery is the mode of treatment in cancer and in endometriosis. Now we do know it is done through a tiny holes. When we do it through a tiny hole, robotic surgery is magnified much more than the normal laparoscopic surgery. We do get a 3D vision. The movements are very, very fine. To do any stitching or removing any disease, it's a very fine. When the cuts are very small, the pain is less. When pain is less, obviously the recovery is much, much faster. Again, as I say, it has to be a teamwork, be it for a cancer or be it for an endometriosis. And here we have a huge team wherein when the patient first comes in, we discuss about the disease and what is the best option that we have for them. Right from preserving the fertility to fertility sparing surgery, we offer embryo preservation before going in for any cancer treatment. If a lady needs any chemotherapy, we do know chemotherapy can have effect onto the ovary and the eggs. So we do right from the beginning till the end. Again, for example, it is just not the surgery like my colleague said, and we just stop there. After surgery, a lady can go through a lot of hormonal issues. It's just not the psychological impact of the disease, but the hormonal issues because of the treatment. And I would say, like being a lady doctor, I can understand those hormonal issues very, very well. And being a gynecologist, I do know how to address them, how to treat them. And we are kind of like there with the patients till the end of their recovery and after that. So at Apollo, I would say I'm very proud to be associated with Apollo because we have a huge team. Like you have seen my other colleagues in other departments, because patients, when they come with these chronic diseases, they have other associated conditions. So it is always a teamwork where we look for a successful outcome both in cancer and both in endometriosis. Thank you.
Thank you, ma'am. Dr. Sridhar PS, over to you.
Good morning and warm welcome and greetings from Bangalore. So, as we know, the esteemed panelists here, what we are talking about is a power-packed, the healthcare systems, which makes it major difference. Non-communicable disease is one of the main things what we are talking, so which is the most common cause of death. So, cardiovascular disease is the one what is already touched upon. Then is the cancer. So, I'm a cancer specialist, a radiation oncologist, and we also talked about the brain tumors, and we're going to talk about head and neck cancer is one of the things. The moment if you talk about anything about cancer, so there are three things has to be remembered. So what is the causation of cancer? Can we prevent the cancer? How to diagnose? How to manage? And most important is the follow-up. So all these things has to be discussed and debated actually when we are talking about. So we know that the prevention of cancer, the causation of cancer is always one of the things we touch upon. Lifestyle, the cancer is actually a lifestyle disease. So when we look at that, the Maldives is one of the not short of it in terms of smoking is or tobacco related cancer is concerned. Probably another things I would like to add is the obesity is another things which makes it more important to address, because it's also a problem for the cardiovascular and indirectly it's also causation for cancer. So how we need to diagnose this cancer, the key thing is early diagnosis is the key in terms of cancer management, and we need to diagnose as early as possible. Do not neglect your symptoms. The most common cancers what we see in Maldives is like in female and male, if you see tobacco related cancer, that's a lung cancer. In breast cancer is number 1, and then comes the cervical cancer, then hepatocellular, colorectal cancers, and prostate cancer in male. That is, these are in terms of like top 10 cancers in Maldives, what we are seeing. So coming to the management of it, the moment if it is, the first time is the best time. So that is where we are crucial in terms of cancer management. That's what we do it in Apollo Cancer Institute. So basically it is not a one-man show. It's always a multidisciplinary team approach. So that is the key in cancer management. So it is not only the numbers, it is actually the man behind the missions and the expertise what we have in terms of starting from the diagnosis to in terms of rehabilitation and follow-ups. So that is what is important. And in terms of cancer management, the targeted treatment is the key. So that is where we are looking at now. And it may be surgical, or it may be like the radiation, or it may be in terms of medical oncology. So quality of life is another important factor, like it may be in terms of organ preservations. That's what we look into in head and neck cancers, and in case of sarcomas, and in terms of like the management, even in terms of chemotherapy, the targeted treatment is the key. So you talked about already robotic systems. Robotic assisted surgery makes it so efficient in terms of management of cancer, in terms of control, and also the quality of life. The patients are out within 5 to 6 days without much of the problems. So coming to the medical oncology, we are looking at the key factors of like advanced techniques, especially immunotherapy, like and the AI-driven oncology treatment. That is the key what we are looking at, and that can be done very effectively with a good roadmap of multidisciplinary team approach. Coming to my specialty, where the radiation is the key, I can say that anything about the radiation, more than 70 to 80% radiosurgery system. And here what we are looking at a very, very precise, highly precise sub-millimeter accurate treatment effectively to practically to any of the area. So it is the continuous tracking is one of the things what we talk. Because you are giving an highly efficient the more dose, it can be treated very effectively with the least side effect to the surrounding structures, and it's with a short duration. It may be 1 day to 5 days. Maybe the patient has to stay only like couple of weeks. So you don't have to stay for like 6 to 7 weeks of radiation is concerned. So especially what are the things what we used in CyberKnife here is there are a lot of places where there's an early cancers. That's what Dr. Satish was talking about, neurosurgical approaches where there may be residual disease or the surgically we cannot reach to that particular stage, or patient may not be eligible for surgery. These are definitely the indications what we are looking at. Then comes, it may be in terms of lung cancer, which is most common, and even the prostate cancer and liver cancers, which is the main complaints in this part of the world, can be treated very effectively in terms of non-surgical approach. Pancreatic cancers, without a major surgery, we can do only CyberKnife robotic radiosurgery, that what we call it as SBRT. So now it is not only limited to the localized treatment, so even in a locally advanced or metastatic disease, where we call it as a stage 4 cancers, we are given the chemotherapy with the combination of immunotherapy, we can go and treat these multiple areas of the metastatic sites, and we have good publications to back up these things, and we have seen not only local control, there is a survival advantage. That is what we are here for, and we don't have to lose hopes in terms of cancer management, even if it is a metastatic disease. So even in an advanced tumors, there is a definitely local treatment makes a difference. One of the things what we are looking at is advanced treatment. Whenever there's a patient, especially in young patients, we need to look into genetic factors. That is what is a tailor-made treatment which makes a lot of difference. And then immunotherapy and the combinations treatment makes a definitely different from others in terms of cancer management. So I think I'll conclude here. So I'll go to Abu.
Insightful. Over to you, Professor Satish Nair.
Morning, Maldives. I'm Dr. Satish Nair. I'm a professor and senior consultant in ENT and head and neck surgery. I'm also an endoscopic and robotic head and neck surgeon, as well as a minimally invasive endoscopic skull-based surgery. So we all know what ENT is. So what's head and neck surgery? So head and neck surgery is that area, roughly if you put it, just below the brain and above the lungs. So you can all understand how complex this area is. This area is your face. This is what you show to the world. You can't hide any disease in this area. So the treatment in this area needs to be precise. In addition to this, it's also an area which has the major senses of the body. We talk about the special senses, the hearing, the vision, the smell, the taste. So all are in these areas. In addition to that, two more important things, breathing as well as swallowing. So imagine a small problem. I would consider, like for example, you know a small thing like sinusitis or a common cold that you get. How many things does it affect? You have a blocked nose, you don't have a good smell, you're not able to swallow food. A simple thing can cause so much of morbidity to a person. So imagine any other disease in this area, what it would cause. So an important area is head and neck, and we need to have a precise treatment to it. Earlier, the goals of treatment was, where any disease is there in the head and neck, to remove that particular part for surgical management. Nowadays, we're not just looking at that. We're looking at something more than that. We just don't want to remove the disease, but we also want to give good function. So these functions that were there, they need to be given back to the patient. That is where the minimally invasive surgical procedures come in. So when I mean minimally invasive, we're going to smaller areas, we're not exposing larger areas, and we're ensuring the functions are preserved. For example, earlier if you had to go to the back of the throat and do some surgery, you would have to cut across a lot of structures. Now we have an endoscope which can go through your mouth, reach that area, remove the disease. If it's a little difficult to reach, we have the the robotic surgery which goes there. Your hands cannot reach it, the robotic surgery can reach it. So what does it do to the patient? It ensures that a lot of areas are not cut open, a lot of form or the function of the patient is not affected at all. In addition to these two goals, now everybody wants a third goal also. And we at Apollo Hospital are, pioneers in this too, to give the form, that is the cosmesis. Imagine a surgery in the head and neck that we perform with a large incision, which cuts across most of the area. You carry the scar throughout your life. So carrying a scar is not great on your face or your neck. So now we do have procedures where we can go through, like we said, the natural orifices, the nose, the ear, or the mouth, and perform surgeries. We also can shift these incisions to be smaller ones and make these incisions go far away from the main area. Maybe the incision is somewhere behind the ear. The incision is, for example, you want to do a thyroid surgery, you can go for incisions behind the ear, from the chest, so these incisions are not seen at all. So all three principles are managed. Remove the disease completely, keep as much as possible function as possible, as this area has a lot of function, and preserve the cosmesis. What does this treatment protocol give a patient? Today, most of the patients want to be in the hospital for the shortest period of time. You want to be in the hospital and get out, perform the surgery and get out as soon as possible. These minimally invasive endoscopic as well as robotic treatment helps in having the minimal time in the hospital. Patient goes out early from the hospital and can resume work, normal day-to-day work as fast as possible. The smaller incisions ensure the incisions are hidden, they are far away, patient can go back to work immediately. All this goes back to a good quality of life. So we at Apollo Hospitals, Banagata, Bangalore, do have these procedures. Army of all these procedures are there with us to treat all cases of ENT as well as head and neck surgery. Thank you.
Thank you so much, sir. Now we are open for the question and
to have questions on any of the specialities, whether it is head and neck, as Dr. Satish said, about cancer in general, radiotherapy and advancements in radiotherapy. Dr. Girish has spoken so much about advancements in cardiac sciences. Similarly, neurosciences I have covered for both for brain and the spine. So virtually the most important super specialties which are difficult to access in smaller places or places where it requires a lot of advanced care. So these are the areas we usually cover in Apollo hospitals, apart from the regular specialties as well. So if you have any specific queries or even general queries, you're most welcome, and we would do our best to answer it for your audience.
Good morning. It was a very informative information for us. And my name is Ali, and I'm from Southeast News. We had a question. Actually, I think most of the audience will be concerned to connect with your hospital. Which are the insurance companies that you will be working, or is there any insurance companies already having established relation with Apollo Hospital Bangalore? And the other thing is whether already our local government insurance, Asanda, is connected to the services that are in Bangalore Hospital.
yes, so Mr. Ali, we have been working with Asanda Insurance Company from last 3 years. These are third anniversary. We also work with Amanata Kaful, and we also work with Allied Insurance. We work with all three insurance companies.
And I have a second question as well. As Maldives is very much involved in sports, and there are a lot of sports injuries happening, especially ACL, ligaments and these things, and full reconstructive surgeries of knees. These are very common, and a lot of, and also recently we have noticed that there is a treatment called PRP being promoted within the community, but I also believe that most of the medical specialists don't recommend PRP much. But for these reconstruction surgeries, is there any special treatments or special opportunities for the sportsmen that are going through the injuries and their rehabilitations? Can it be done while rehabilitations can be done within local facilities with your instructions?
To answer that question, we have a sports medicine department as well as surgeon. It just doesn't work in silos. There is an orthopedic surgeon, neurosurgeons, spine surgeons, physiotherapists, and rehab specialists work as a team. We have one specialist working with us for last 8 years. He has put back 4 people into Olympics playing squad for the national team. So that's the competence that we have, irrespective of which game you play, whether it's football, shuttle badminton, cricket, various sports-related injuries. We have dedicated specialists. Some could have sports-related, others could have sports unrelated by birth disorders. Even they are detected and treated to full resumption of sports capability, and the rehab team works around them to put them back into the best shape at the earliest.
I would like to ask, with your permission, for third question as well. As an island nation, we are very dispersed in the ocean, and we have like 189 islands. There are still a lot of our living population living in the islands. Does Apollo Bangalore have a specific target of having some camps with awareness within our community to the islanders, which some flights are directly operated from the south and north to Bangalore right now? So.
Yeah, Ali, we have been invited by Asana Insurance Company from last 2 years, and we have been conducting camps in all these islands. We have covered actively 8 islands, from Kashidu to Fuamula, Kudavahidu. So it's been ongoing for us, and we continue to do so.
Thank you.
So that is just to add that that's one of the key factors. Like when any cancer management, anything, whatever we do, unless you follow up those patients, is always an issue. So we are cognizant about that, and we'll continue to do that.
I hope I have cleared with the insurance companies. We have been working with them, and it's been successfully. We have completed 3 years, and we look for more expansions.
Hello and welcome to Maldives. My name is Lyusha, and I'm from One Online News. I have a question for Dr. Rani Bhatt. As she has mentioned and given information about endometriosis, I would like to know what are the causes of this disease, and is it different from PCOS, and what are the treatments for it?
Okay, thank you for that question, and I think it's a very important question for us to understand. PCOS and endometriosis are 2 different conditions. To put it very simple, in PCOS, like we understand, every lady, after 14 days of her menstruation, the egg comes out. We call that as an ovulation. So we have 2 hormones. Before ovulation, we have estrogen. After ovulation, we have progesterone. In PCOS, what happens is that because of the hormonal disturbance, the egg is not released. So we have only estrogen and we don't have progesterone. So this person will have only estrogen for a long time, and suddenly she'll start bleeding because estrogen has become too much in her body. So that is the imbalance between the estrogen and progesterone, and that's a condition called PCOS. Now PCOS is a very, very benign condition. It's commonly seen in young girls. It is just not related to only ovulation and periods. It's a complex hormonal problems. No wonder you see PCOS girls are like obese. They'll have hair onto their face. They'll have a lot of pimples. So it is a complex hormonal problem, is a PCOS. Now it can be easily treated, and if not treated, because most of the time young girls, what do they think is that, oh good, I'm not having periods headache every month, once in 2 months, once in 3 months, I'm so happy with that. That's a very wrong thing for them to feel, because if estrogen is there in the body for a long time and this continues every month, these girls are at risk of developing uterine cancer. As I just mentioned previously, why are young girls coming to us with uterine cancer is because of this hormonal imbalance. So PCOS is a hormonal imbalance between the estrogen and progesterone. Endometriosis, there is ovulation, unlike PCOS, the egg comes out, there is progesterone and the lady bleeds. Normally we understand the bleeding from the uterus comes out through the cervix and vagina. At the same time, some amount of blood trickles through the tube and can fall into the tummy, which happens to every person, every lady it happens. This can get settled there, and few of them it triggers. Now, which are those girls who triggers is that again there's a hormonal imbalance, little bit of high estrogen, the endometriotic spot in the body, it triggers. Now, every month the lady is bleeding out, but this one doesn't have an outlet. So what that happens is they bleed internally and they can develop a cyst. So that is endometriosis. So there is ovulation, there is estrogen, progesterone, but estrogen is on to the little higher side and it falls inside the tummy. And they will not have like PCOS, they will not have any hair, they will not have any pimples or anything. And they're not obese. PCOS generally they are kind of like tend to be on the obese side. PCOS can be just simply treated with medically. They don't need any surgery at all. Just medically, the first would be lifestyle changes. And even with lifestyle changes, good exercise, it doesn't, then we go in for the medical management. Endometriosis, yes, if we are lucky, we can identify in a very, very early stage, we can treat them with medically. If not, then we'll have to go for surgical management.
Thank you for the answer. My next question is for Dr. Special from Cancer. In Maldives, there's a lot of young girls having breast cancer problems, and a lot of young girls having abscess also in between the breast and in between the skin also, breast skins. So what is the causes of this and what is the treatment for this?
Okay. So first of all, that's what your observation is absolutely right. We are seeing a lot of young people coming up with the breast cancers, like especially less than 45 years, 35 to 45. We are seeing some patients even in 20, 25, unmarried people. So there are 2-3 factors we would like to include. One is genetic factors, where we are talking about the breast cancer in the family. So like that is one BRCA1, BRCA2 mutations will be there, which runs in the family. That's why any young patients, genetic testing requires for those patients. And by and large, they behave differently from normal breast cancers. That's why it is very important to identify those subsets and treat aggressively. So there are effective drugs available, and there is effective treatment for the breast cancer in early, and you need to identify and continue the treatment. That is number one. Number two, one step backwards, how to identify any breast lesions. I think it should not be neglected. Please go to the like your family physician or the local doctor, so that it should be excluded as it does not have cancer. Abscess is another biggest confusing things in case of breast cancer, especially immediately after the baby. So there may be always breastfeeding, and they say that, okay, there's abscess because of the breastfeeding. So we are seeing those are the times where there is hormonal imbalance. So there is always a possibility. My dictum is any patients who have any problem in the breast, it should be shown to the local doctor and exclude. So make sure that there is no tumor rather than thinking that it may not be.
Thank you.
Hello, I'm Fatima Baava from PSMA. My question to you is, how would you describe your experience treating Maldivians, and can you also provide an estimate of how many Maldivians you treat in a monthly basis?
An estimate, I can say we treat about approximately 70 patients from Maldives monthly, and about their experience, it is always good to hear from the doctors. So can you just put few words?
as I said, we've been treating for last 8-10 years. I think Maldivians are one of the most pleasant people who seem to understand when communicated what is the disease, what are the treatment options available, and what is the care that needs to be taken post-procedure and following up with their local physicians and come back in contact when required. I think they're a well understanding community, and largely they adhere to the treatment advice given, and the challenge has been the smoking. I think we need to work on that.
Adding to this, like we really appreciate the initiative of the government in, like taking care of the treatment, which is really unique and excellent. We really appreciate for that.
Oh, I have one more question. We haven't mentioned arthritis. I just wanted to. It is one of the main diseases in Maldives, right? It's very common in our region. I would like to ask why it is and how do we prevent it?
Although it is in the domain of orthopedics, and I am a spine and neurosurgeon, but we do see an increasing incidence of arthritis. So basically it is a degenerative condition. So degenerative meaning in the knees and especially in the hips are where the two major joints which get affected by arthritis. One of the factors is the fact that even in Maldivians, the life expectancy has been steadily increasing. If you see the map out for the last 40-50 years, more and more people are living to be into their 70s and 60s and 80s, etc. So as we age, a lifetime of usage of these joints, there is a natural degradation of the joint cartilage, and therefore there is a risk of developing this osteoarthritis. Now, in arthritis, we have to say that the most common one is osteoarthritis, which is a lifestyle and degenerative disease. One is age, second is obesity. Obesity has a very direct and important link to developing arthritis at an early age. The other types of arthritis, basically they are inflammatory, like rheumatoid arthritis and other conditions which require a little bit of expertise from the rheumatologist to work up, and then they can be effectively managed medically. But coming to your question, both the hip as well as knee, they require many times when the joint gets worn off and the quality of life is affected, the patients are no longer able to perform their normal activities day to day in a pain-free manner, and they have already exhausted all the conservative means. Then the solution for them would be what is known as arthroplasty or total joint replacement. Now, I would be happy to say that in South India, our Apollo Hospitals is one of the leading hospitals which has developed the state-of-the-art cutting-edge technology, especially when it comes to robotics. So there is something called as the robotic total knee replacement, total hip replacement by robotic, etc. This enables the patients to recover very fast. The post-operative pain scores are very less, so they are able to cooperate for the rehabilitation faster. And our surgeons also have the expertise to do both the knees or both the hips in the same sitting. So the shorter stay means the patients don't need to be away from Maldives for a very long time. And they do work with other specialists like the physiotherapists to put them back on their feet as early as possible. Thank you.
Thank you.
That question where you said that why Bangalore and why one. So there is a direct flight. Now there is Bangalore is Maldives to Bangalore, and the weather is very pleasant. And of course, what we are looking is an experts, the man behind the machines. That is what makes a difference. And how the Maldivians have taken it. So we have treated a lot of patients more than a decade now. So the one testimonial probably is like yesterday I have a dinner with one of my patients, like father who's died almost 6 years back. So that is one of the testimonies. Thanks.
Thank you so much. I would like to extend my heartfelt gratitude to the press, our partners, and the wonderful people of Maldives for their warm welcome and support. Together, let us pave the way for a healthier, happy future. Thank you for being here today, and we look forward for the exciting journey. Thank you so much, sir. On the dais, thank you so much, sir.